So it's the first drug made from your own body's cells, part of your immune system called T cells. And the T cells are taken out of your body as in a blood donation process and then sent to a manufacturing plant where they're genetically modified to insert the CAR molecule. Then they're returned back to the hospital and then given to the patient as a single infusion. The removal to the reinfusion is called devayne time, and that's 22 days now for Novartis. Part of it is, the shipping. They're shipping on each way to a central manufacturing plant, and then the actual growth time in a lab is about 12 days. And then after the cells are grown, you need to show that they're, fitted for infusion, meaning that they're not infected or anything like that. So all that is 22 days at this point. So the first approved therapy in 2017 was for a kind of leukemia called ALL, or acute lymphoblastic leukemia, and for ages 3 to 25. That's what the FDA approval was. It was one of these Lazarus moments. We thought she was going to die. She had multi-organ failure, a fever of 104 to 106 degrees that we couldn't stop. And it turned out that was actually a good thing, because we didn't know it at the time, but that was the leukemia cells being killed by her infused CAR T cells. We've now learned how to manage that so that it's not such a severe reaction, but she was very close to not having survived that cytokine release syndrome. She literally woke up very rapidly after we gave her the drug that blocks cytokine release syndrome called tocilizumab. And after that, the leukemia, we did a bone marrow examination, and she was in remission. So within a week, she had pounds of leukemia that had been killed by her CAR T cells. So Emily Whitehead was treated when she was 6 years old, and now is 14 and going into high school. Like many new technologies, they're usually less able to be broadly distributed and are more expensive initially. CAR T cells now are, for leukemia, cost in the U.S. $475,000, but it's the first drug where it's given on what's called pay-for-performance basis, where if it doesn't work, the patient and the hospital don't have to pay for it. So it's expensive, but it's custom manufactured one by one for each patient, and there's never been an example like that where it's made individually. These T cell therapies, remember, your immune system has cells that are made to kill invaders, but it also has cells that shut off responses so that we don't get autoimmune diseases like arthritis or multiple sclerosis or lupus. So it's possible not only to amp up the immune system and treat infections and cancer, like with the current CAR T cells, but it's also possible to shut down the immune system in people who have autoimmune disease. And so there is research to prevent or treat diseases such as lupus. So sickle cell anemia is an example of what's called a monogenic disorder. There's 100,000 people in the United States that have this. It's incurable at this point, and ultimately fatal, usually around age 30, and require many transfusions and have side effects. So it now appears with CRISPR therapy and genetic editing that actually can be repaired and patients cured in early experimental trials. So I'm hopeful that in the next several years this will become an FDA-approved procedure for patients with sickle cell anemia.